Welcome to Vetted Health News. I'm Dr. Felicia Stoller. Vetted Health News is a multimedia brand providing health and lifestyle news that is entertaining, but more importantly, is substantiated by science. Our mission is to critically examine and deliver unbiased health, medical, and lifestyle information with the same journalistic integrity as hard news, politics, and current events. You will find us here each week providing episodes on topics that affect our lives. Each show has recurring segments. Psych Watch covers mental health issues. Weight of the Nation is our weekly discussion about healthy lifestyles. Our Quack Quack segment will highlight something utterly ridiculous related to the topic of the week. FDA updates will address drugs and procedures that may have been approved or removed from the past week. Each week we will debunk a health myth. The politics of health will touch upon government and/or policy. Finally, we want to hear from you. Send us questions or comments about something you'd like to discuss or explore. We'll highlight topics important to you. Reach us via Twitter, Facebook, or through our website. May is Mental Health Month. It was started by Mental Health America back in the 1950s. For many people, they don't need 1 month to recognize mental illness because they live with it. I had the chance to speak with Teresa Nguyen, who is the Senior Director of Policy and Programs with Mental Health America, to discuss their focus this year.
Our campaign this year is about bringing the individual's voice to the table through technology and creating a space where people can say in their own words, my depression feels like this. Mm-hmm. Because we often find that people struggle with, the clinical or technical terms of understanding what mental health problems are. And it's so clinical, it feels so distant from what I personally am experiencing that we wanted to try and find a space where people just can talk about those things that are a little more humanized and real in that sense. So if you follow the hashtag mental illness feels like, you'll come to a microsite that we created where people can share postings, video, stories. We're creating a micro space where that kind of activity is really enhanced.
Mental illness is not as easy to diagnose because there's no one test, no blood test, brain scan, or other imaging that can make an accurate diagnosis. And beyond that, treatment options vary, even if you're lucky enough to have access to care. According to NAMI, the National Alliance on Mental Illness, 1 in 5 adults, and the same statistics hold true for children, will experience mental illness in a given year. In fact, half of all chronic mental illness begins by age 14. Forget about puberty, add this to the mix, and the reality that children are transitioning from adolescents to teenagers and change schools at the same time. Bullying is a whole other problem that impacts children's emotional well-being. 90% of children who die by suicide have a mental health condition. It's the second leading cause of death for people under the age of 24. Look around and the numbers are staggering. Adults in the U.S. living with serious mental illness die on average 25 years earlier than others, largely due to treatable medical conditions. It is estimated that 20% of adults suffer from some form of mental illness. 46% of homeless adults staying in shelters live with severe mental illness and/or substance use disorders. 20% of state prisoners and 70% of youth in juvenile justice systems have at least one mental health condition. It is thought that most, if not all, people who abuse drugs, alcohol, or even food have underlying mental illness, which is what makes treatment even more challenging. We need to consider how we frame treatment.
Things start to fall apart. It's really hard not to feel a lot of guilt or shame.
Yes.
That maybe I couldn't do this or I'm screwed up again. Mm-hmm. And that kind of framing, I think, is it's hurtful, honestly, to the process of getting better. Because if you get stuck in that process and you don't realize, you know what, this is not because of you that you're bad, right? This is inherently understood, and we get that with cancer. Cancer comes back,
right?
So do mental health problems.
Beyond medications, there is device support.
Device support like ECT or TMS Those are mostly aligned with depression treatments, especially for treatment-resistant depression. And I think that those technologies are like science. We're learning about them. The whole spectrum of care for what is available to treat to people takes both a medical approach and a personal relationship approach. So you mentioned medication and device treatment. That's kind of a more medical approach, right? But you also have counseling, and counseling spans a full spectrum. And this is something I don't think people know, right? We know that when I get sick, I'm going to go see my therapist or my psychiatrist for like 15-minute session or a 15-minute session. But if you need more help than your weekly visit or your monthly visit, there are some counties and some states that have enhanced community-based services that are really much more effective at supporting people who have more difficult situations.
Despite effective treatments, there are long delays, sometimes decades, between the first appearance of symptoms and when people get help. The consequences for lack of treatment impact all of us. During Mental Health America's recent office relocation, Teresa Nguyen was surprised by documents in their archives. Seemingly, while we've made progress, some things remain the same.
This 1913 document laid out all the things that we continue to want to improve in the system. We want to make sure that providers, clinicians, helpers, people themselves who understand the scenario, the situation that's happening during a crisis situation, for example, is called and brought in to intervene rather than calling the police. Right. That was something that in 1913 they had said we should focus on prioritizing this response. Instead, that's something that we still haven't succeeded on doing.
Wow.
The 1913 document also said we need to focus on prevention. We need to focus on early intervention. Right. This is a goal that Mental Health America still is fighting to move the system towards. We continue to wait until people are too sick, right. Suicide, homelessness, right. Incarceration. We literally only serve people when they have reached a stage where the mental health problem is much more profound and much more difficult to treat. And don't put enough resources and supports to making sure that people get support when they need it as early as possible, typically around teenage years.
Right.
That said, in the last 20 years, there have been certain gains. Specifically, research and technology has, we have put some money to ensuring that in small incremental ways that we've been able to improve things.
Serious mental illness costs America $193.2 billion in lost earnings per year. Individuals living with serious mental illness face an increased risk of having chronic medical conditions. Mood disorders, including major depression, dysmorphic disorder, and bipolar disorder, are the third most common cause of hospitalization in the U.S. for both youth and adults aged 18 to 44. We've seen mental illness portrayed in movies like One Flew Over the Cuckoo's Nest, Silver Linings Playbook, The Black Swan, Psycho, A Beautiful Mind, Benny and June, Jacob's Ladder, The Fisher King, and even in the classic A Streetcar Named Desire. Ask anyone who knows or lives with someone with mental illness. Some of these movies touch a raw nerve. More recently, mental illness has been attributed to crimes, and a plea of insanity is a legal means for avoiding the death penalty. Every time there are crimes committed with guns, the NRA is quick to reinforce the message, guns don't kill people, people kill people. Every time one of these massacres occur, we're left scratching our heads wondering, what could we have done differently to prevent this from happening? Beyond access to the weapons, where was anyone to help the individual about to do these heinous acts? We are quick to point our fingers for blame, however, treatment is not always so easy. For some, denial is a big problem. Just look at Adam Landa, the man who committed the devastating murders of children at Sandy Hook Elementary School. He started the day killing his very own mother. It is easier for people to get their hands on firearms than get the care that they need. In October 2014, there was another parental murder in Long Island that slipped under the radar for most of us. Pat Ward, a 66-year-old English professor, tried for months to get her son Derek, a 35-year-old personal trainer, an appointment with a psychiatrist. Dozens of doctors said they either didn't take his insurance or wouldn't see patients with Derek's complex condition. The same thing that happened to Pat happens all the time to others. Many simply never returned her calls. 3 days before the scheduled visit to the psychiatrist and 4 days after his medication ran out, Derek killed his mother Pat with a kitchen knife. He decapitated her, dragged her body and severed head into the street outside of their home in Farmingdale, New York. It was a crime so gruesome that passerbys thought it was a Halloween prank. Derek then walked to a nearby railroad track and threw himself in front of a commuter train. Unfortunately, the best treatment includes medications and behavioral therapy. Prescribing the right drug or combination of drugs is even more tricky. Unlike something as simple as a statin, which we all know will bring down someone's cholesterol, the various types of drugs used to treat mental illness do not have a guaranteed effect in all people who take the particular drug, which means it can feel like playing Russian roulette with one's care. Teresa Nguyen shared that there's a disparity in care across the country.
We have pockets where at least you can get some care.
Right.
And we have large pockets where you don't get any care.
Don't you think that's a problem? I mean, you as we, all of us as American citizens, it really shouldn't matter which state you live in, right? I mean, we should, it's one of those things. It's, people argue about things being a state right or a state privilege, but really, there are so many times where we talk about it really shouldn't matter what your zip code is or where you reside. We should all, as Americans, have access to the same care, right? I mean, same thing with mental health.
I absolutely agree. We have to make sure that people have adequate systems.
Right.
So that the science that we learn can actually get implemented timely and well, and where there isn't disparity across states. Like, I talk to people from the South or from the Midwest, and these people still live in states where they cannot access any care at all.
Right.
As opposed to where I came from in California, where I saw people access some of the best care I've ever seen.
Among the close to 200 different mental illnesses, there are a few major categories: mood disorders, anxiety disorder, personality disorders, and psychotic disorders. Some you may have heard of in the mood disorders are bipolar and major depressive disorder. In the anxiety category, there's generalized anxiety disorder, ADHD, OCD. For psychotic disorders, there's schizophrenia and borderline personality disorder. For some, life experiences may impact a person's risk for developing mental illness. For others, it's 100% genetic in that they are simply born with the predisposition to develop a mental illness. There is still a negative stigma associated with mental illness. People are more apt to share their physical health woes versus their mental health challenges. In some cultures, and perhaps naivete among others, can cause a person suffering or their family or friends to be in denial about their loved one's illness. In fact, some who suffer have their own shame. This can delay early treatment intervention. Unfortunately, many people start treatment after they've been exhibiting full-blown symptoms, which may coincide with social, academic, professional, and often financial consequences. There is a lack of adequate coverage by insurance companies for the cost of treating mental illness. Beyond the drugs themselves, the counseling, hospitalizations, and even many, if not most psychiatrists do not even accept payment by insurance. They are private pay. An increasing number of doctors have been dropping insurance as demand grows from easier to treat high-dollar cash clients who don't usually phone them in the middle of the night or pose a safety threat. According to research published in JAMA between 2005 and 2010, the number of psychiatrists taking private insurance or Medicare has dropped almost 20% to 55%. That compares with other specialties where 93% take private insurance and 86% take Medicare. Obamacare was supposed to help level the playing field by requiring individual and small employer insurance plans to include mental health benefits. Yet because of the low reimbursement rate by many of those plans, few doctors will take them, and those who do have long waits. As a result, primary care doctors are most likely prescribing psychiatric drugs to many people who really should be referred out to psychiatrists. For our health myth, I want to address the idea that people who are mentally ill can just snap out of it. After all, if it was that easy, wouldn't people just do it? This has to be the most challenging belief system that individuals who are suffering deal with. It's like asking a diabetic whose pancreas no longer produces insulin to just will their pancreas to produce insulin. It just doesn't work that way. Mental illness is about a biological and often chemical process or imbalance that causes the individual to act or feel different than others. Even for the most empathetic of caregivers, frustration over the amount of time it may take for their loved one to feel better, if even at all, can take a toll on their personal health. Treatment options take time, and for many, dealing with the day-to-day responsibilities can be too much to bear. What's new with the FDA and psychiatric treatment? Not much. So far in 2016, there have not been any new psychiatric drugs approved. In 2015, there were only 3 new drugs approved for psychiatry. All were for the treatment of schizophrenia and/or bipolar disorder. In 2014, only 1 drug was approved for treating opioid addiction. Despite the large number of people who have mental illness and the challenges of proper prescribing with inconsistent results, you would think there would be more options from the pharmaceutical industry. While medications are just one aspect of treatment for mental illness, what is already out there is just not enough. The politics of mental illness treatment is expansive, if not overwhelming. Treatment options vary by state in terms of public health options for those who do not have private health insurance. The sickest patients have been turning up in homeless shelters and jails. Look around most major cities that have homeless people on the street, and you can bet that those individuals are living with mental illness. It's estimated that 46% live with severe mental illness or substance abuse. Federal legislation requires more expansive insurance coverage for mental health services. The Mental Health Parity and Addiction Act of 2008 applies to large employer-sponsored insurance plans. It bars insurers from putting up financial barriers to mental health care that are greater than those created for physical treatments. According to NAMI, states cut $1.8 billion from their mental health budgets during the recession. States play a larger role in providing mental health services than they do with physical health. Access to mental health care is worse than other types of medical services. In 2010, the Bureau of Labor Statistics estimated that the country had 156,300 mental health counselors. Access to mental health professionals is worse than for other types of doctors. 89.3 million Americans live in federally designated mental health professional shortage areas, compared to 55.3 million Americans living in similarly designated primary care shortage areas. Mental health care is expensive, with 45% of untreated patients citing cost as a barrier. A quarter of the 15.7 million Americans who received mental health care listed themselves as the main payer for the services, according to one survey that looked at those services from 2005 to 2009. The majority of those who did seek outpatient treatment had out-of-pocket costs up to $5,000. Despite coverage, the out-of-pocket costs are a barrier for care. So far, in the 114th Congress, 226 mental health bills have been introduced. 130 are in the House of Representatives and 80 in the Senate. 4 out of the 5 that were enacted were for veterans. It is fair to say that serving in the military and seeing and experiencing modern combat has created a huge crisis in our modern times. Sadly, we continue to lose, on average, 20 veterans every day to suicide. Our Quack Quack piece is about the notion that being a lesbian, gay, bisexual, transgendered, or queer is a mental illness. This belief is firmly rooted in traditional religion. Writings in the Old and New Testament state that sexual relations among members of the same gender was considered wrong. Even the great-grandfather of modern psychology, Sigmund Freud, later in his life expressed pessimism about the possibility of affecting a sexual conversion in most people. In his 1935 letter to an American mother, he reassures a woman asking him to cure her son that, and I quote, "Homosexuality is assuredly no advantage, but it is nothing to be ashamed of, no vice, no degradation. It cannot be classified as an illness. We consider it to be a variation of the sexual function produced by a certain arrest of sexual development. Many highly respectable individuals of ancient and modern times have been homosexuals. Several of the greatest men among them, Plato, Michelangelo, Leonardo da Vinci. By asking me if I can help, you mean, I suppose, if I can abolish homosexuality and make normal heterosexuality take its place. The answer is, in a general way, we cannot promise to achieve it." The American Psychiatric Association, APA, removed homosexuality from its official Diagnostic and Statistical Manual of Mental Disorders, the DSM, in 1973. This occurred as a result of the momentous cultural changes brought on by the social protest movement of the 1950s to the 1970s, beginning with the African American Civil Rights Movement, then evolving on to the women's and gay rights movements. The idea that there are still some fringe people who claim that they can treat or provide conversion therapy for LGBTQ people into traditional sexual roles, we know this is simply ridiculous. In our Weight of the Nation segment, I'd like to tackle the issue of disordered behaviors, from obesity to anorexia, overexercising to orthorexia to body dysmorphia and self-harm. Regardless of what we call each of these sets of behaviors that have a tremendous impact on a person's daily life, at the root cause of each of these is underlying mental illness. Whether one drinks alcohol, takes recreational drugs, or overeats food, it comes down to uncomfortable feelings and thought processes. For a moment, cutting oneself feels like a release, to feel pain when otherwise numb, or to cause surface pain because the other pain that is felt is too hard to bear, or that the repetitive thoughts need something to shake it up and redirect their pain in the moment. I have worked in private practice as a dietitian, nutritionist, and exercise physiologist for 16 years. Just when I thought I've seen or heard everything, someone else walks through my door, or I read a story about a person whose suffering touches my heart. I am, after all, in a caring profession. My biggest frustration as healthcare professionals who are supposed to be working as part of a team is that there is a lack of evidence-based, effective treatment for many. How can several siblings grow up in the same environment, perhaps share DNA with their siblings and parents, and yet one has a totally different set of coping mechanisms than the other? In some situations, siblings even share dysfunctional behaviors, and some do manifest their own mental illness. Some lie and hide their illness in shame, yet it always comes out to impact our society in some way, and it's usually not positive. We speculate when those we put on a pedestal, like celebrities, actors, musicians, and athletes, have inappropriate behaviors or seem unwell. When that superstar finally reveals to the masses that they've been suffering with some form of mental illness, we commend them. Perhaps it makes the headlines of the day, and then it quietly dissipates into our lives. Labeling should not be about shame, but about a means of identifying the proper modalities that might be beneficial for treatment, whether it be drugs, supportive counseling, cognitive or dialectical behavior, electroconvulsive therapy, or transcranial magnetic stimulation. Sensitivity to the fact that really nobody wants to be that way should become part of our new enlightened contemporary mindset. Force-feeding an anorexic or providing bariatric surgery to a morbidly obese individual is a temporary solution. It is essentially a Band-Aid. The real treatment goes much further than the numbers on a scale and associated comorbidities or health ailments that the person has. It's not easy, but our healthcare system must work to find a way to have better treatment that is based upon successful outcomes and to have access for those who need it. With the help of Charity Navigator, Money Magazine identified mental illness and suicide prevention charities where funds are put to good use. These organizations received high ratings for their extremely high levels of accountability and transparency for donors, how well they have sustained their programs, and the high percentage of their revenue spent on programs and services rather than on administrative or fundraising costs. The American Foundation for Suicide Prevention works to understand and prevent suicide by supporting research that looks at the causes of suicide. It also works with federal and state government on policies to prevent suicides and to care for those who are at risk. The Brain and Behavior Research Foundation awards scientific grants to those working to make discoveries in understanding the causes and improving the treatment of mental disorders. They've awarded close to $310 million to more than 3,700 scientists in the past 25 years. The Treatment Advocacy Center works to improve the treatment of severe mental illness by promoting policies and practices for the delivery of psychiatric care and supporting the development of treatment for and research into the cause of psychiatric illnesses. The Trevor Project is a national organization founded by the creators of the award-winning short film Trevor. It provides crisis intervention and suicide prevention services to lesbian, gay, bisexual, and transgender teens and young adults. Now, we'd love to hear from you. We want you to be involved by leaving a comment below or reaching out to us on social media via Twitter or Facebook. The best discussions happen after the episode is over at vettedhealthnews.com. Our tweetable of the week is #MentalIllnessFeelsLike. Did you like this video? Yeah? If so, subscribe to this channel and share it with your friends. I'd like to end by saying the healthy choice is the easy choice. You just have to make it.